Next up is Chloe, and the title of Chloe's project was Enhancing Hospice Care Through Occupational Therapy, Developing Educational Resources for Caregivers and Healthcare Professionals.
Hi everyone, so my name is Chloe, as Dr. Renner said. I decided to do my project on occupational therapist role in hospice care. So I knew I wanted to focus on improving quality of life rather than typical rehab that occupational therapists are used to. So I chose a population that we are not really found in that often, which is hospice care. So the more I looked into OT's role in hospice care, the more I realized we really aren't in there, but we can make a really big impact. So I completed my capstone with Park Home Care and Hospice. So they're a home care and hospice-based organization in West Bloomfield, Michigan. And I worked with hospice care patients and caregivers. That was my main population. So the goal of this was to educate on the awareness of OT's role in hospice care, highlight how OTs can support comfort, safety, and meaningful engagement while reducing caregiver burden. So to do this, I completed a literature review and had conversations and collaborated with my site mentor, Amanda, who is a nurse, and we used that information to create evidence-based resources that occupational therapists can give out to their patients. So the literature strongly supports the need for OT in hospice care, but there was a large gap, which is that we're underutilized. Oftentimes, health professionals don't fully understand our role in hospice care. So studies have shown that OT can improve their patient comfort, enhance safety, and increase caregiver confidence. So while this is consistent theme throughout the literature, that more education and advocacy are needed to just better integrate OT into hospice care. So I focused on education and advocacy for my project. So overall, throughout the 14 weeks, I researched and created deliverables that were focused on improving healthcare professionals' understanding of OT's role, increasing therapist confidence, and easy-to-read caregiver handouts to support a better patient care. So my first handout, which I'll pass around. My first handout is Occupational Therapist Transition Guide supporting patients moving from traditional home care to hospice. So at the start of this project, when I was collaborating with Amanda, she told me the importance of how sometimes therapists are seeing patients in home care that are being discharged from home care and are going to be evaluated for hospice care within the next week. So I thought it was important to create a guide that outlined some common interventions, ways to evaluate a patient, when OT should be referred, what we do in hospice care as occupational therapists, a checklist for therapists, and how we can talk to the other interdisciplinary team members, as well as ethical considerations, so when to discharge and when to stop services altogether. My second deliverable was a healthcare provider decision guide for referral and collaboration. So like I said before, we're underutilized because of not getting enough referrals. So I wanted to make a handout that talks about why OT matters in hospice care and what we do. Who we are, why would you refer us, what can we do, how can we help people, and which one of your patients should be referred. So they'll see in there that I put functional decline, increased dependence on caregivers, fall risks, and increased time spent in better chairs. And I also added in there about what happens after occupational therapists are discharged from there. And then my last handout was a caregiver education handout. So I've chose 4 easy to read handouts that are used for caregivers that are for environmental safety and home modifications, supporting meaningful engagement, positioning, and safe mobility. So they were guides that I want to create that weren't just read over once, but some that are easy to access and are just a quick scan that you're able to identify how to help your patient or who you're caring for. So without occupational therapy involvement, many of these go unaddressed. Patients and caregivers become overwhelmed and unsure. That's where occupational therapy has the potential to make a meaningful impact. My biggest takeaway from this is that OT doesn't become less important in hospice, it actually becomes more meaningful. So in many settings, we focus on progress and improvement, but in hospice care, it's really comfort, dignity, and quality of life. It's often the smallest interventions that make the biggest impact, like positioning somebody comfortably, helping a caregiver feel more confident with their transfer, or supporting a meaningful interaction between patient and family. This project helped increase awareness of OT's role in hospice, and through practical care and easy-to-read resources, we can make a difference. A challenge I faced is not having immediate implementation. So like many of us have said, it was only 14 weeks, and all I could have done was create these deliverables that I hope one day are able to be implemented at Park Hospice Care. So there's still a lot of room and growth, and advocacy was just the beginning. So overall, the project reminded me the importance of bringing meaning and increasing quality of life for patients. So thank you to everyone who is a part of this project. Thank you, Dr. Renner, Dr. Kehoe, and thank you, Dr. Enja, for helping me 3 years ago come up with this idea. That's all. Yes, Amanda?
What are some other ways that occupational therapy can affect hospice other than like physical needs?
So we play a big part in mental health, so emotional needs for the caregivers, just being that support system to help them so they don't feel like it's a burden or feel overwhelmed or burnt out throughout while they're or caring for their family members. Anything else? Dr. Renner?
Great.
Hi.
Great job.
Thank you.
Can I ask a twofold question?
Yeah.
Okay. So, what was something that you felt was really surprising that people didn't know OT brought to the table is part of it, and then the other part is, what did you find that shined really bright for OT that you maybe didn't go into the project thinking about?
So something that people don't know is that we do work in mental health. I think that's like newer. So that we're there providing those services not just for the patient, but more so for the caregiver, teaching them techniques, burden, things like that, how to cope with it, taking time for yourself. What do you do that's meaningful for yourself? And then what was your second part? Sorry. What did I feel?
What was something that you found that like maybe you didn't go into this project thinking like OT shines in this area, but as you developed your 14 weeks?
That's a good one. Yeah, I would say that we shined really well in, I feel like going back to the caregiver, like we talk about it, but it's really like what we do. It's a lot of education. It's a lot of showing and teaching. So I would say more like that it's not so much the patient itself, but the caregiver that is our patient.
Nice job.
Thank you.